suction on. It should be on continuous, and like we talked about, in our yellow range. I like to be a little high toward the yellow. That's going to be our suction. If there is a yang power or something else on the end of the suction, I'm going to go ahead and take it off. All right, and I put my suction somewhere where it's easily accessible for me. I'm also going to, if the patient's on oxygen, I'm also going to unsnap their oxygen so I can easily maneuver it to get them oxygen back and a suction okay. All right, check their oxygen saturation. It says they're good. If it says they're not good, I'm going to crank up the oxygen a little bit, finish getting set up, and recheck the oxygen before I suction. When we stick a tube for suction down in that trach, we're blocking off the airway. So their O2 sat is going to drop a little bit. I want to make sure it's high enough that it's safe to drop a little bit. Okay? All right. So for right now, I'm just going to turn this off so we can hear. Okay. All right. Patient might be on room air and might just need a little bit of oxygen, or we can hook a bag up and bag them. I don't do that a whole lot anymore. All right, so I have all of my supplies, except for, this is a goobery process, so before I get going, I lay that across the chest. Trash, which is over there. I'm going to call it there. This is a little high for me. I'm not as tall as Jessica. Okay. And that's not going to come out, it's going to be sealed. I like to order things in the way that I'm going to use them. I'm going to open my sterile field. Trash. I take out my sterile field. That touched all in there, but that was sterile, so that's okay. The bottom got contaminated against the bed, but again, that's okay too. All right. I take the corners here. This is just my way. Fluid.
So we could do this with bare hands as long as we wash them?
Absolutely. I'm working with sterile and clean stuff, so what would I be, think about what needs to stay sterile and why. Okay. If I wanted to, I can go ahead and grab this one if I thought I might need some more fluid, but I'm not going to. All right, before I put my gloves on, I need to check everything. I need to make sure I have all of my supplies. This wasn't sterile to begin with, so it doesn't need to go on the sterile field. It's just going on the patient's neck. I have my obturator in place. I've got my oxygen, my suction's good. I've educated my patient on what we're doing. I have a towel down. I'm good to start with my gloves. Okay. There already is one in there. So I see this glove is folded over. See that? Mm-hmm. And I see fingers on this one, so I'm going to go for the folded over one. And I touch my sterile field right there, so I have to make sure I don't go back, put anything sterile right there. That's how the gloves opened up. So I step away from my sterile field, fingers down. These gloves are a little small on me. I'll get there without breaking them. Now I can get my other one. Make sure we're doing glove in. I see my thumb on that side. So I'm going to go this way. If I wanted to go the other way, I could just turn it over and go that way. Okay, I step away, fingers down, and this is where we take that thumb and stick it out so we don't contaminate.
But when you're grabbing them, you can put your thumb on the inside?
Absolutely.
Okay.
You know, what do I not want to touch with my thumb? Why is the reason I move my thumb? Look at where my hand is.
You don't want it.
I don't want to touch my skin. Even if it touches the inside here, it's still sterile.
Okay.
I just don't want to, and what we have a tendency to do is we grip it and we put our thumb and right there. So we hitchhike our thumb. That's with all sterile gloves. Okay, if I don't know what to do and I got sterile gloves or I need a minute to think, I just interlace my fingers, think about what I need to do. Okay? This is the old tie. I'm not going to use it. Me personally, I like to get things out of my field that I'm not going to use. I am going to use this. I'm going to put underneath the patient's flange, and I possibly might have to clean. This is the biggie that I need to keep sterile. These are the scrubbing or cleaning instruments that I don't use anymore. I'm going to untwist. Remember when we're doing sterile field stuff, we drop it. We don't lay it down because then we're more likely to contaminate. Okay.
So the white part goes down on the back?
I don't care, however you do it. And this is just to add to my sterile field in case I happen to touch here. That's all it is. It's just an added protection. I don't have to use it if I don't want to. Okay. I do not wrap this around my finger because I cannot advance a catheter that way, but I do make sure I get the end, and I do a zigzag. That's me. However you want to do it is fine. This part and my hand part, I need to make sure I keep away from this part that's not going to be sterile. Okay? All right, so then with my other hand, I'm now going to contaminate, double check, is there anything that I need to do that needs to be sterile? Nope, looks pretty good to me. What I did not have in this kit, I threw them away. Did you see that?
The Q-tip.
I was
gonna say you need the Q-tip.
Someone has one. I have sterile gloves on.
And well, that would be
No,
contaminated
so
anyway.
I
But you can come open them for me.
Sterile.
By the way, the video says this is a 2-person procedure. It hasn't been a 2-person procedure in a long time. It's just you.
Okay.
Just drop them. Okay. Thank you. All right.
Do you have to wear a mask during the procedure?
I don't have to wear a mask for this procedure. Well, what does your benchmark say?
Mask and gloves or
Mask and
Goggles.
goggles.
Mask and goggles.
Mask
Yes,
and
you will have
goggles.
masks and goggles, which I had, but
Even goggles? Or just is a mask okay?
that's what your benchmark says. That's what we're gonna do.
Okay.
Okay. I'll get goggles for you so that you can practice with the goggles on Friday.
Thank you.
Please remind me. All right. I have
The rooms have the masks with the shields. So I
Yeah.
think that would be.
Okay. All right, so yeah, it is good because they're going to be, when I'm suctioning, there could be spittle that comes out. So it is good.
Okay.
But my glasses used to serve as, my facility that I worked at, glasses were okay instead of goggles, so. Okay.
Excuse me.
I'm going to move, actually before I do that, I'm going to hook up.
So the second you touch that tubing, that's your
I'm contaminated.
non-dominant hand is contaminated?
Mhm.
Yeah.
And if I was in benchmarks, what I would say is, okay, I need to go get another kit because I didn't have my Q-tips. But you notice I saw that before I got stuck.
Yeah.
So I would just go get another kit. So I would say, okay, in benchmarks, I would go get another kit because I dropped my Q-tips over there. I got a little antsy throwing stuff away. Then you just pick them up, throw them back over, and keep going. All right? Okay. And now I want to check my suction. So these holes go in the water. Suction works well. That also helps to lubricate the catheter. I'm back over here. And I'm going to move my oxygen, double check my oxygen saturation. It's good. And I'm going to go in the inner king straight down as far as I can go until I meet resistance. I'm not worried about the oxygen because my patient was satting okay. They were oxygenated well, all the way in, and then I'm going to intermittently and swirl on my way out, making sure I don't contaminate this tubing. Okay, I can clean it in between, and I can do it again.
When you insert it, are you blocking this section off?
No,
Okay.
no. Then I won't be able to insert it. It'll suck against the patient's, watch my thumb, it'll suck against the patient's lining of their trachea. Okay, all right. So I'm done with that part. I can let go of this. I don't need this anymore. Okay.
So when it says ask a partner to hyperoxygenate,
Nope, it's just
disregard
you.
that?
Well, you're not going to hyperoxygenate. Your patient's going to be satting great.
Yeah.
Don't even worry about it. We're moving
Okay.
on. All right, I'm going to clean around the stoma now. So I have to take my garbage one out, and I'll throw it in my garbage. If I didn't bring my garbage over, I can throw it not over my sterile field, but I can throw it in my garbage here. I can put it over here. It's no longer sterile. I don't care. All right, Q-tips. And I suctioned in here, so I'm going to dip in my clean water. And I'm going to clean around the bottom of the stoma. And I get rid of that in my garbage, which I said was over here. And I'm going to clean around the top of my stoma. Okay, drop that in my garbage. It's all clean. I'm going to take out, pinch, and remove my old trach. Put my new one in. Pinch and secure it. And if I need to dry around my stoma, I can dry if I've got cruds. And then I'm going to go ahead and put on my new trach. I'm no longer sterile on either hand. I don't need to be. Make sure these are going the right way, so I always put my tags down so that I know that they go this way. And I'm going to get this into the patient. I could have done this before I started if I wanted to. Sometimes I do, sometimes I don't. And then I'm going to hold down the flange, release one side. If I need to clean more, that one's still okay, but I can clean if I need to clean more, if I've got goobers. And then I'm going to get my new one. Right here.
When would you put the clean?
I don't care. After you suction. Anytime after you suction
So
is
you
fine by
can
me.
like do it when it's loose and just stick it. Like,
Oh,
The gauze.
the gauze.
I do that. I do that when I do my
Oh,
So I loosen. Because it's only on one strap and then one strap on the other one. It's not secure, so I have to keep my hands on the flange. So when I take the one closest to me, I've got better control. So that's when I get
okay.
personally. You can do it however you want. And then I checked before I started, I checked my little thing to make sure I've got. I'm not touching the center of the gauze. It's fine.
So it's okay to have both of the straps off at the same time?
I have my hand on the flange the entire time. As long as I have my hand on the flange. And that. Okay, get my old one out. And I like to make sure it's secure and that I have a little bit of room for this patient. All right, I'm gonna put their oxygen back on. Check an O2 sat. O2 sat is good. And I clean up and I'm good.